Welcome students to our new YouTube channel Pharmacist Take the Division of Excellence. So today is our World Pharmacist Day. So in this World Pharmacist Day, we will discuss about the role of pharmacist and responsibilities of pharmacist. What are the importance of pharmacist in today's world? So let's see why pharmacy. So the pharmacists are the medication experts who enhance the patient's care and they promote the wellness. And also you will use your professional knowledge as a pharmacist to prepare and dispense the prescriptions and also ensure the medicines and doses are correct and also prevent the harmful drug interactions, and also you counsel the patients on the safe and appropriate use of their medications. And as a pharmacist, you will have unique and specialized expertise about the composition of medicines, including their chemical, biological, and physical properties, as well as their manufacturer and their use of medicines. And also the other healthcare professionals will rely on you to select and administer the medications that offer the best results and quality of life for a particular patients. And as a pharmacist, you may prepare a personalized medications, and also you participate in the patient's round at the hospital and also reduce the spread of infections, conduct researches or clinical trials, or also focus on a specific patient populations or a disease state. For example, diseases like diabetes, heart disease, asthma, HIV, that means human immunodeficiency virus, and also pain management. So be a pharmacist and help people to live better and healthier lives. So also the pharmacist play a key role, that means pharmacist play important role in helping patients to feel better and get well as quickly as possible. And also the patients do best when pharmacists are a part of their healthcare team, because the pharmacists are the medication specialists, and also the pharmacists improve the medication adherence, and they are culturally competent healthcare providers who communicate effectively to evaluate many factors that affect the patient's ability to take a medication. And this includes the diet, lifestyle, transportation, language barriers, and much more. And also, the pharmacists are working directly with the patients. So, the pharmacists are accessible in all healthcare settings, in patient, ambulatory, and community settings. Pharmacists are available to see the patients at convenient times every day of the week, during morning, during evening, and also in weekend or hours, and without an appointment. They are licensed to provide the immunization in all 50 states. Many states also allow the students pharmacists to provide the pharmacy service under the supervision of a pharmacist. Also, the pharmacist may also provide other services such as asthma care, blood pressure monitoring services, cholesterol screening, diabetes disease management, smoking cessation consultation, bone density scans for osteoporosis screening, and also anticoagulation management clinics, and much more. So also the pharmacy is a diverse and rewarding career. So as a career, there are various opportunities in pharmacies for a patient care, and also scientific research and innovation in the field of pharmacy. And also the pharmacist, they can work in a myriad of professional setting, and the majority of pharmacists, that means 45%, work in an independent or retail chain community pharmacy, and they provide the counseling to patients on the use of prescription and over the counter, that means OTC medications. And also the pharmacists work in a numerous other healthcare environments as well, including hospitals, nursing homes, managed care organizations, the pharmaceutical industry, colleges, and also schools and the federal government systems. And also the pharmacists play a key leadership roles in all the aspects of the healthcare systems. And also the pharmacists work with other healthcare professionals to maximize the health outcomes. Numerous studies have proven that the presence of a pharmacist on hospital rounds as a full member of the patient's care team has been shown to prevent the medications errors and it reduces the costs. So the pharmacists provide the optimal management of medications for chronic diseases such as asthma, diabetes, hypertension, etc. And the collaboration of healthcare professionals such as physicians and pharmacists, they can also help to ensure that the patients properly take their medications as prescribed and avoid any harmful side effects. And also the pharmacists are employed in every part of the country, every part of our country. Pharmacy licensure is generally reciprocal between the United States. However, the additional tests or criteria may be required to transfer licensure status, that means licensing status. And the also the pharmacist may be able to establish non-traditional or part-time work hours depending on the practices setting. And also the most Americans live within the 5 miles of a pharmacy, so pharmacists are needed all throughout the United States. So one of the many exciting developments in the pharmacy professions is the growth of a discipline known as pharmacogenomics. The genetic variations in the genes, they can affect a body's response to a drug, and in the future specialists in this area hope to sequence the entire human gene in each individuals. Pharmacists, pharmacists and other healthcare providers will be able to use that information to select the best medicines and also to treat disease earlier than now possible or prevent them entirely with individually tailored drug therapies. And also the in digital India, the digital innovations in pharmacy include the electronic prescriptions, robotics for central prescription processing, and nationwide prescription monitoring programs, as well as the pharmaceutical research. And these technologies advance the enhance efficiency and help to promote the patient safety. And also the pharmacists use these some tools to help priorities work, and also to manage the dispensing process and spend more times with the patients. And by law, the pharmacist must oversee the automated dispensing processes for quality control purposes, that means QC. And also the pharmacist can provide innovative approaches to medications management, including the recommended therapies and the identification and resolution of problems with the aid of the state of the art technology. Also, the pharmacists are well educated to recognize signs and symptoms of a diseases that may be used in a biological attacks. And the accessibility of a pharmacies could be one of the keys to a successful mass immunization of a drug distribution program in an emergency. So, in an epidemic or in a bioterror situation, pharmacists are prepared to play a major role in preventing the spread of disease and overseeing the distribution of the appropriate and safe medications. According to the CDC, pharmacists are equipped with the necessary skills to improve our nation's health, and they are vital members of the team in our public health initiatives or in public healthcare system. So and also the according to the recent Gallup polls, pharmacist honesty and ethics were rated as high or very high by a large majority of Americans. And also the pharmacists are visible leaders in our community who are interested with our healthcare system or health of our families. So these are the importance of pharmacist, role of pharmacist in field of pharmacy. So thank you for listening this video on the occasion of World Pharmacist Day. Thank you.